Most clinics won't tell you this. Sometimes it's not the hair follicle is dead, it's actually trapped. This is how scalp fibrosis actually happens, which traps your hair follicle from growing. Firstly, through chronic inflammation, which starts the process. The most common trigger is androgenetic hair loss. Hormones like DHT cause inflammation around the follicle. The body interprets this as a damage, so it sends repair signals. Secondly, the body releases fibrosis signals. Inflammation activates a pathway which involves growth factors such as transforming growth factor beta. This signal tells the fibroblast cells in the skin to produce collagen and extracellular matrix proteins. This is the body's attempt to strengthen the damaged tissue. Then collagen begins to accumulate. Normally collagen helps to repair the tissue, but when the signal continues for years, collagen builds up around the follicle. Now this is what creates a fibrotic sheath around the hair root. Think of it as tightening the sleeve around the follicle. Now blood starts to reduce. Fibrotic tissue is stiffer and less vascular. What this leads to is reduced oxygen, reduced nutrients, poor circulation. Hair follicles depend heavily on blood supply. Then the follicle starts to miniaturize because the environment worsens. So follicles shrink, hair becomes thinner, growth cycles become even shorter. Eventually the follicle becomes totally dormant. However, it doesn't die. So in advanced fibrosis, it can become permanently inactivated. So why the crown is commonly affected by scalp fibrosis? The crown area has higher androgen receptor density. It has greater DHT sensitivity, so more inflammatory signaling. That's why fibrosis often develops there first. Other things that can happen and accelerate scalp fibrosis, these include from chronic scalp inflammation, poor scalp circulation, tight scalp tissue, long-term androgen exposure, oxidative stress, aging and scalp tension. Important point is that not all the follicles are dead, many are simply trapped in the fibrotic environment. If the scalp environment improves, some of the follicles can be reactivated. So think of this analogy. Think of a hair follicle like a plant root. If the soil becomes hard, dry and compacted, the plant struggles to grow. Fibrosis is basically compacted soil around the follicles. So we in Rock Health Clinic in Birmingham, the way we treat